Smooth 98.1. Love music, love life. This is a Business Express. It's Zibby here. I've got guests joining me, but before we introduce the guest, I'd love to let you know how you can be a part of the conversation. The WhatsApp number is 0809 4440981. You can also tweet at Smooth981. And we're also streaming live on our YouTube channel as well. So you can catch that live stream up on YouTube. The channel is Smooth981. And don't forget to subscribe. We're talking about the minimum wage in Nigeria's healthcare sector. Our special guest this morning is Dr. Tychus. She's the CEO and founder of Getmed Co. Good morning, Dr. Enna, and welcome.
Thank you. Good morning.
All right. So lovely to have you. And we're all aware of this minimum wage saga that has been ongoing for a very long time. Now, the governors in Nigeria are saying, look, we cannot even afford to pay the 60,000 minimum wage, which certainly does make sense. They have struggled to pay the 30,000. Lots of people have gone without salaries for months in so many states across the country. So what is your reaction to this?
Yeah, so when we look at the minimum wage or the wage situation for doctors, when we're talking about wages, we have to look at what's the education level, what's the need for the specialty and all those kind of things. So doctors are typically at the top of the food chain because we do need doctors for the health of our nation, quite literally. So when we look at this and we look at other countries, we see that people are gravitating or what they call jackpot now to Canada, to UK, because these countries are making it so attractive for physicians to transition over there. And why is that? Number one reason is actually the wage difference. They get paid at least 1,000% more than Nigerian physicians do.
That is a huge percentage.
That is a huge percentage. Also, they have better healthcare facilities, which happens to be the number two reason for doctors leaving. So I think, this is a problem. And, when the government says we don't have enough, it's always tricky because then you hear how much senators make and, people in the government make. And it's like, when, so people feel, they don't feel good about it because they don't feel like there is actually a lack because some people are getting it, but others are not, right, especially with how hard they're working.
All right, thanks for that, Dr. Enna. So what would be an ideal increase in Nigeria in terms of wages for doctors and healthcare workers that would encourage them to stay back or even perhaps come back for those who've left already?
So I'll be realistic to say what we should focus on now is trying to stimulate the exodus. It's hard to compete with salaries across the sea and everything. So right now I would recommend at least a 200% increase in the physician salaries, at least, because we have to be able to compete so that people feel comfortable working here. And then also there are a lot of physicians in the diaspora who want to come back, who want to help. They might not want to come back full time, but they're willing to provide their services. So having something that's a little bit competitive would also help to not just retain, but also invite new people to come back.
Now, you are the founder of Getmed and you're an entrepreneur in this healthcare space. Do you think that players like yourself can actually pay a minimum wage of 60,000 naira or 100,000 naira if possible?
I plan to pay much more than that.
Okay.
Yeah, absolutely. I do treasure physicians. I believe that a physician should be appreciated. We went through a lot of school to get to where we are, and we do a lot of sacrifices that people don't even see or don't even know. And we carry a lot of burdens of the health of our patients when patients pass away, when they have bad outcomes. So I do think that physicians should be fairly compensated, and I'm very passionate about that. And my company does pay very well to physicians.
What about the other workers in the sector?
Absolutely. And nurses, and other physical therapists and everything. I do believe that it should become more competitive so that we can retain our workforce. in the
Okay.
health in healthcare.
All right, we're speaking with Dr. Enna Tychus. She's the CEO and founder of Getmed. And we're speaking about the wage saga. So if you've got a question, you've got a comment, this is the time to send it through. The WhatsApp number is 0809 4440981. You can also tweet at smooth981. The hashtag is Business Express 981. And don't forget, we're streaming live on YouTube as well. So you can catch that live stream. It's Smooth 981. That is the channel. And also subscribe. Anna, how would you assess the level of skill in the healthcare sector currently in Nigeria?
So I'll start historically. So let's start from the back. So Nigerian doctors used to be able to compete on the world stage. Um, so far, there has been a significant drop in the confidence in the skills of our trained physicians, and also the physicians who have been practicing for a long time. And I'll talk about both. So number one, the training of the physicians is starting to be questioned. Number one, how much access do they actually have to new equipment, to new information and data and studies that have come out? Number two, for the trained physicians, how much of continuing medical education are they doing? So I'll give you an example in the States where I've practiced, and where I was trained. You have to do continuing medical education every year. You actually have to get credit so that you can renew your license. And renewing your license happens every 2 years.
That's
But
a
you have
lot.
to show, yes, but you have to show proof
Mm.
that you have learned this much within that time frame. And the reason that's done is so that they're sure that you're keeping up to date with the new data that's coming out, the new research that's coming out. So I think, having doctors who are relevant, who are current, is really important. And in some cases, we've seen that there's a significant discrepancy in that. So I hope that my hope is that with the new training, with people coming in from abroad and things like that, and more emphasis on this continuing education, I'm sorry, that this would improve.
All right, now let's talk about healthcare and money. I mean, we always have to talk about the money, right?
Absolutely.
Affordability. Now, a lot of Nigerians still have to pay out of pocket for their healthcare, the treatment for themselves and families. Do you think that possibly a universal healthcare scheme could actually work in Nigeria and be truly effective?
That would be fantastic. I think it would be effective. So as you know, this is what is practiced in the UK and Canada. They tend to have a more socialist economy. And the downside of it, I do have to be honest, is the taxes are unbelievable in those countries. In the US, it's very different. It's a capitalist economy, unlike the socialist economies. And because of that, so the government subsidizes or pays for the insurance of people who fall below a certain wage gap or wage salary gap. And then everybody else pays for their insurance. So I think that that's the model that should be employed in Nigeria so that it is more of the people aren't taxed unless you won't invite new business to Nigeria. But I do think that there is a lot of room because one of the major issues is the accessibility of care and the equity of care. If people who, are in the poverty line, which is a lot of Nigerians, could have access to care, could be able to go to good hospitals, that would be a huge difference, because a healthy country is a wealthy country, literally.
Absolutely. KB via WhatsApp says, good morning. Pay and welfare are the reasons why people jackpot, but it's not easy out there. The government should shift ground to make people stay. Now, speaking about the government, what can they actually do? What should they be doing? What have they not done for so long with regards to healthcare delivery?
So there's a lot that the government can do. The government, there's a significant capital investment that has to go into healthcare. And I think it is the most critical industry at this point. It's actually in crisis. So there are five things. Number one is investing in training. So, reducing the ability or the criteria, I would say, for people to get into medical school. Number one, right? So before they used to redirect you to biochemistry or microbiology if you didn't meet a cutoff. So I feel like, you're channeling people's dreams the wrong way. So how can we kind of adjust that so we get more people into the medical schools? I hear that there's some things going on here. Retention, that pay is really, really, really important, especially for the government to help to subsidize that. Increasing access access to care is what I was just talking. So through insurance. Number two is through creating multiple sites, satellite sites where people can get care. So all these things that I'm saying, they are all very heavy capital investments. But if the government chooses to do this within the next 5 years, Nigeria will be a totally different place.
Wow.
So it's the accountability of funds too, because
Mm.
sometimes you hear, oh, this amount is going out, but how much actually reaches the end user? So I think if we stymie all that, we should do better.
And we spoke about 5 years. Is there a possibility that
Yeah.
in 5 years we'd see medical tourism reversed? I mean, a lot of Nigerians are traveling out of the country to get their healthcare needs met.
Absolutely. But even now, people are actually coming the other way because physicians from the diaspora are coming back home because they're hearing what's going on. So people are coming back to offer their services. One of my colleagues just came back to open even a orthopedics fellowship. So people are coming back to do different surgeries and things like that. And because of that, the physicians that people had to travel to go see are now
Mm.
here. So it's coming back. People start staying, but there are certain things that need to be done first.
All right. So I've got a final question for you,
Mhm.
Dr. Enna. What is your advice for aspiring healthcare entrepreneurs?
So number one is I would say have your vision. What do you want to do? What do you want to accomplish? What do you want to be remembered for? Number two is secure your funding. So if you don't have personal funds, look for angel investors, investment companies, banks that would help to support the vision. Make sure it's very clear. Make sure that you have the right people on board. People make up your company. You have to have the right people on board. And I believe with these three, and your systems is the last one. Have systems, have processes that are repeatable, that are excellent, that are efficient. Um, and these four things will actually help you have a very, very successful practice.
All right. Thank you for that, Dr. Enna. Let's take one more message. This one says the government should enforce policies to insist leaders treat themselves here in Nigeria and they should focus on education and health. That is
Mm.
it for Business Express this morning. Thank you, Dr. Enna
Thank
Tychus,
you
for
so
being on the
much.
show. That was Dr. Enna Tychus, CEO and founder of Getmed Co. Do stay with us. There is a lot more to come on the Smooth Breakfast.